Good evening. I think we'll get started. I was just saying we were so pleased that, I don't know if many of you were at last year's event, but the weather was so poor. And if it had been last week, we would have all been in a big pickle. But we're really pleased that the weather's cooperated, beautiful weather for this annual event. So I just want to talk a little bit about the Chanchlani Global Health Research Award. It was originally created by the Chanchlani family in Mcmaster University in 2010 to recognize leading international scholars in global health. Each year, a number of candidates are reviewed for the award, and the candidate is chosen with a panel, and this year we had actually several possibilities, so we're very pleased to have Dr. Camilla here with us today. I would like to thank the Chanchlani family who are here today. For their continuous support of this award that honors the memory of course, Mr. Vasu Chanchlani, who we miss. As I said, annually we get to think about him and realize what a privilege it was to meet him and how much we do miss him. So this award is very fitting. And I would like to take this opportunity to introduce the Chanchlanis. They're not all here, only some, but an extra one is here this year, which is great. So we have Dr. Tina and Dr. Sonia, talking to you, and of course, Mrs. Dr. Chanchlani. They actually have so many doctors in this family, I can hardly, it's amazing, and quite accomplished family. And I'm pleased now to turn this over to Dr. Sonia Anand, the director of the Chanchlani Research Center, to introduce this year's recipient of the Chanchlani Global Health Research Award. Sonia?
Thank you very much, Andrea. It's a pleasure to welcome you all here, and especially a great pleasure to introduce Dr. Camara Jones. I attended the first conference in migration, ethnicity, and racism in Edinburgh, Scotland in May of this past year, and jet-lagged, I went to the Saturday morning sessions, and only to be really energized after hearing Dr. Jones' presentation, and I'm really grateful that you're here to share that with us. Dr. Jones is very accomplished. She has completed her medical degree at Stanford, her master's and PhD in epidemiology at Johns Hopkins University. She taught at Harvard School of Public Health, worked at the CDC, and is the past president of the American Public Health Association in 2016. She's now at the Morehouse School of Medicine in Georgia, and her message resonates greatly with me. In my research work, we often consider ethnicity and or race in the analyses of our research. In our academic institutional environment, some of the issues of equity, diversity, and race are raised. And then personally, as a South Asian woman who grew up in rural Nova Scotia, a number of your messages resonate with me. So it's a great pleasure to have the Chanchlani family here and to welcome Dr. Jones as our 7th Chanchlani Global Health Research Award recipient. Thank you.
Good afternoon, everyone. And how is the sound way in the back? It's good. I am so honored, first of all, to be the 7th annual recipient of the Chanchlani Award. And to have the opportunity to share with all of you some of the tools that when I was president of the American Public Health Association 2 years ago and traveled all across my country and actually a little bit outside as well, I was launching what I described at that time as a national campaign against racism. So you might be, oh my goodness, really? And they invited you to come places and talk about racism? Yes, they did. And I was highly effective because of my way of communicating some very important issues through allegory. So I'm going to share with you some of my allegories on race and racism. And usually, if we had all the time in the world, I would actually invite you to interrupt me at any point if you had a question or a comment, or I might even stop and say, okay, now I want to hear from you. But because we don't want to be here all night, I will just say this. I won't stop and invite your input, but if I say anything that resonates with you so much that you want to give me an amen, or that strikes you as being so foreign, you're like, why is this Yankee coming up here talking to us in Canada about racism, and you want to say this is not my experience, or anything in between, if you just wave your hand wildly, I will finish my sentence and then I will recognize you. But I'm not going to do my usual stops along the way because of the respect for time. I'm going to start with a story based on my own real life experience that I call Dual Reality, a Restaurant Saga. And if I only have 5 minutes to introduce notions of how racism operates, this is the story I tell. So the real life experience was that I was a medical student at Stanford, and of course, being very studious, I was studying one Saturday with some of my friends in my apartment. And we were studying long and hard, and it got late, and we got hungry, and I had no food in the apartment, which was typical. But never mind, my friends understood, so they were like, okay, let's just go into town and find something to eat. So we go into town, and we find a restaurant. And we walk in and we sit down, and the menus are presented. We order our food. The food is served. Here we are eating. Not a very remarkable story, yet most of us have had this kind of experience. But as I sat there eating with my friends, I looked across the room and I noticed a sign. And that sign was a startling revelation to me about racism. So now I've intrigued you. Dr. Jones, what did the sign say? Well, what the sign said was open. So now I know I've lost most of you. Okay, never mind. So let me recap. Here we are, sitting in a restaurant eating. I look across the room. I see a sign that says open. If I hadn't thought anything more about it, I would have assumed that other hungry people could walk in, sit down, order their food, and eat. But because I knew something about the two-sided nature of those signs, I recognized that now, because of the hour, the restaurant was indeed closed, and that other hungry people just a few feet away from me, but on the other side of the sign, would not be able to come in, sit down, order their food, and eat. And that is when I understood how racism structures open-closed signs in our society, that racism structures a dual reality. And for those who are sitting inside the restaurant at the table of opportunity eating, and they look up and they see a sign that says open, they don't even recognize that there's a two-sided sign going on, because it's difficult for any of us to recognize a system of inequity that privileges us. So it is difficult for men to recognize male privilege and sexism. It is difficult for white Americans in the United States to recognize white privilege and racism. It is difficult for all U.S. Americans to recognize our global privilege, right? Our American privilege in the global context, except we got a little taste of that with Ebola a few years ago. But those on the outside are very well aware that there's a two-sided sign going on, because it proclaims closed to them, but they can look through the window and see people inside eating. So back inside the restaurant, to those who ask, is there really a two-sided sign? Does racism really exist? I say, I know it's hard for you to know when you only see open. In fact, that's part of your privilege, not to have to know. But once you do know, you can choose to act. So it's not a scary thing to name racism. It's actually an empowering thing. It doesn't even compel you to act, but it does equip you to act, so that if you care about those on the other side of the sign, which is an if, but if you do, you could even talk to the restaurant owner, who is, after all, inside with you, and you could say, restaurant owner, there are hungry people outside. Why don't you open the door and let them come in? You'll make more money, and oh, the conversations we could have. Or maybe what you'll do is pass food through the door, or maybe you'll try to break the glass or tear down the sign, but at least what you won't be doing is sitting back saying, wonder why those people don't just come on in and sit down and eat, because you'll understand something about the two-sided nature of that sign. And so I am being very careful, as you heard me speaking from my U.S. context, because this is maybe just my third or fourth trip as a professional person in Canada. I do not know Canadian history or the current context, but I bet that it resonates with you all here as well, right? And I have, on several occasions now, completely derailed my control of time by asking a single question. How could people who are born inside the restaurant know something about the two-sided nature of that sign? Because there are many, many ways to know. But I'm not going to stop there. I encourage you, after this is all said and done, to maybe ask that question, remember the story and tell it to one of your classmates or somebody in your family and have that discussion. But we're going to carry on because I've said the word racism a few times. Nobody fell out of their chair. That's good, right? But now let me define what I mean when I say the word racism. So when I say racism, first of all, I'm understanding that I'm talking about a system. I am not talking about an individual character flaw or a personal moral failing or even a psychiatric illness, as some people have suggested. I am talking about a system of power. And a system of doing what? Well, it's a system of doing two things, of structuring opportunity and of assigning value. And on what basis is the opportunity structured and on what basis is the value assigned? It's based on so-called race, based on the social interpretation of how one looks in a race-conscious society. And, you know, in the United States, in Atlanta, where I live, you look at me, I'm clearly black. In some parts of Brazil, you would look at me and I would be just as clearly white. In South Africa, you'd look at me, I'd be clearly colored. I actually had to ask, what am I here in Hamilton? Because it's all about the social interpretation of how one looks, and I'm told that I'm of African origin. Okay, right. Here I am, with the same physical appearance, but in these various settings, the social interpretation of my appearance would assign me to 3 or 4 different racial groups, right? And furthermore, if I were to stay in any of those settings long enough, then my health outcome would probably take on that of the group to which I've been assigned, even though I'd have the same genes in all of those places. So race is the social interpretation of how one looks. Racism is the system that operates on that so-called race to structure opportunity and assign value, and it has 3 impacts. The first impact of racism is that it unfairly disadvantages some individuals and communities. And when people think or talk about the word racism, this is usually where they go. But every unfair disadvantage has its reciprocal unfair advantage, so that racism is also unfairly advantaging other individuals and communities. That's the whole issue of unearned white privilege that we hardly ever talk about in the United States, because at least in that context, it makes some people, especially some white people, uncomfortable. And I often say, I'm not trying to make anybody uncomfortable, and I may have made some people in this room uncomfortable. I'm not trying to make anybody uncomfortable. I used to say, if I made you uncomfortable, I'll tell you some more stories. Please shake it off and stay with me. But now, actually, I say, if you feel uncomfortable, lean into that discomfort, because the edge of our comfort for all of us is our growing edge. But in addition to this reciprocal relationship between unfair disadvantage and unfair advantage, racism has a third impact that many of us don't even recognize, and that is how it is sapping the strength of our whole society through the waste of human resources. In the US context, I can give you many, many examples, and maybe some of you guys want to say something now or maybe not for the Canadian context, but in the US context, we are still not vigorously investing in the full, excellent public education of all of our children, because the blinders of racism have made some people believe that there is no genius in the barrios, the ghettos, on the reservations. We can get along very well, thank you, without those kids. But of course there's genius in all of our communities. And if we were to only vigorously invest in that genius, we could be doing so much better as a nation or even as a world, right? I often think we might already be up on Mars farming if that were a good idea. If we were to invest in all of the genius that is lying just discarded in my country. The same blinders that don't value all of us equally have also made our nation complacent with what I describe as the wholesale warehousing disproportionately of so many black and brown men in our prison system, as if that didn't separate us from human potential. And I don't know if Aboriginal, Indigenous people if First Nations people in this country are overrepresented in your prisons or not. But you know, that represents not only a loss for those individual families and a loss of opportunity for those individual people who are incarcerated, but it represents a loss of the human potential. If there had only been some other way, these people who are involved in our justice systems could be contributing so much more to our society. There's so much genius. If you know any of these people, you know there are many geniuses locked up in this system. I actually think when we're thinking about the impacts of racism, that third point about how racism saps the strength of the whole society is actually the story that we need to be lifting up in all of our countries right now. That is the urgent acknowledgement, right? Even if some communities are unfairly disadvantaged or advantaged, this system and its persistence is sapping the strength of our whole society. We need more media stories about that. Students and researchers, we need more data collection exploring that problem. We need more conversations around our dinner tables so we will have more people filled with a sense of urgency to dismantle this system and put in its place a system in which all people can know and develop to their full potentials. Before I leave this slide, I just want to say one more thing. While I was at the Centers for Disease Control and Prevention, CDC, I came to a time where the people with whom I was working didn't feel that racism belonged anywhere on CDC's agenda, but if it did, it certainly didn't belong in our division. You know, I had just moved to that division. And I was told that by somebody who had to clear my slides that I needed to take that second point about unfairly advantages other individuals and communities off of my slide. I had already talked about the unfair disadvantage. No need to talk about that. Long story short, I left CDC, right? I went to Morehouse School of Medicine. But that experience taught me something very important, that in my country and perhaps here, there are many people who think that there are people who are disadvantaged and then there's normal, right? Disadvantaged and normal. And the reason that people think that there's disadvantaged and normal is because we are ahistorical and do not recognize that our so-called normal is built up on a whole mountain of unfair advantage. I'm going to carry on now. I don't know why we have a blank slide. I must have done something to do that. Okay, here we go. Okay. So I'm going to carry on now because I've talked to you now. I've given you a story about racism. I've given you a definition about racism, which is clear. It's about a system. Whenever I talk about racism, I am not trying to divide a room into who's racist and who's not. We are all adversely impacted by this system, right? But now you might be wondering, this is the Chanchlani Global Health Research Award. What does talking about racism have to do with health? So now I'm going to share with you what I call my cliff analogy. It's a cartoon animation that explains that addressing racism and other systems of structured inequity is core to the health enterprise. So here we go. Whoops! Boom! Somebody just fell off of the cliff of good health. And if that were you or somebody in your family, you would be delighted to find an ambulance at the bottom of the cliff to speed you on to care, right? But if we were concerned about other people who might come along that cliff face, so if we were concerned about population health, public health, community health, we might well ask ourselves, what could we put in place as a health intervention besides just stationing lots of ambulances at the bottom of the cliff? So somebody is going to say, I know, let's put a net halfway down, right? That way, even if people fall, we can catch them before they get crunched up at the bottom. So that's an excellent idea, although the more you think about it, nets do have holes in them, so some people might fall through the cracks. So never mind that, we could actually make that a trampoline halfway down, no holes in a trampoline. But even if we had a trampoline halfway down that cliff, we might well find ourselves with lots of people just bouncing up and down at half functionality, not able to get back to the top of the cliff. So what else could we put in place as a health intervention? Well, clearly we need to be thinking about a fence at the edge of the cliff to keep people from falling in the first place. But even that fence is going to have to be a very, very strong fence if there's a lot of population pressure against it. So what else could we do as a health intervention? Well, we could move the population away from the edge of the cliff. So let me label the interventions that I've described so far, where the ambulance at the bottom of the cliff represents acute medical care and what we describe in public health as tertiary prevention. We talk about 3 levels of prevention: primary, secondary, tertiary. Tertiary prevention is preventing complications from disease that's already manifest, like preventing amputations from diabetes or the like. So that's your ambulance. The net or trampoline halfway down, these are our safety net programs, often in our social services, as well as secondary prevention, which is early detection, screening programs. So in the clinical setting, it could be prostate cancer screening, breast cancer screening, and the like, which could also be in a community setting, right? Primary prevention, that's the fence at the edge of the cliff, keeping bad things from happening in the first place, which could be immunizations, right? Or policy interventions, like a tobacco 21 policy to prevent, we're just trying to get there in the US, right? To prevent easy access of young people to tobacco products. Moving the population away from the edge of the cliff is what is now recently being described as addressing the social determinants of health. What are these social determinants of health? Those are the determinants of health and illness that are outside of the individual. So they're beyond our individual genes, and they're beyond our individual behaviors. And they are, in fact, the context of our lives. So they include individual context, like individual education, occupation, income, wealth. Moving the population away from the edge of the cliff then includes addressing poverty, right? They include neighborhood context, whether there are jobs in your neighborhood, even transportation to a job. What's the quality of the housing, of the schools? Can you get fresh fruits and vegetables in your neighborhood? Can you walk safely in your neighborhood? Lots of different things. So addressing adverse neighborhood conditions is a way of addressing the social determinants of health, addressing environmental hazards, all of that. So you could take an outcome like infant mortality and say, well, we recognize we need some of all of these different levels of health intervention. How would infant mortality play out here? Well, maybe the ambulance would be our neonatal intensive care units. The net or trampoline halfway down might be prenatal care. The fence at the edge of the cliff might be excellent maternal nutrition, whatever kinds of programs you might have for that, or parenting, pregnancy circles or the like, support at the individual level. Moving the population away from the edge of the cliff might be, in the U.S. context, excellent educational opportunities so that young girls have more options available than to have a baby so young. Right? But as useful as this diagram might be for starting conversations with communities, how should we be spending our health resources, or starting conversations with a health council or with your lawmakers, as I have presented this so far, it has a huge fatal flaw. And the huge fatal flaw is that it doesn't yet equip us to talk about how health disparities arise, differences in health outcomes by population groups. So I want you to remember this cliff. Keep it in the back of your mind for a moment. We're going to shift gears to talk about how health disparities arise on at least 3 levels, and then we're going to come back to the cliff. So how do health disparities arise? Well, of course, there are many axes along which health disparities arise. So, along racialization of different populations, along, indigenous status, along social class, lots of different things. In the U.S., the hugest and most permanent, long-standing axis along which health disparities arise is race ethnicity. And we unfortunately have lots of evidence about differences in the quality of care received within our healthcare system by race and ethnicity. Our Institute of Medicine released a report. But it's not just the quality of care received within the healthcare system, the fact that depending on your race, your chest pain might be differentially, get differential attention or even treatment, depending on your race. Or if you had a long bone fracture and walked into an emergency department, there might be differences in how much pain medication you might get depending on your ethnicity or race. So that's differences in quality of care, even within the same care system. But also we recognize there are differences in access to health care. In our system, probably not as bad here, because at least you have this national health insurance scheme, which we do not have. Oh my God, So I know you pray for us every day on that. But, right. But then, we all need to recognize that health is not created within the health sector. So a third level at which health disparities arise are differences in the conditions of our lives. Differences in our life opportunities, exposure, stresses, which make some individuals and communities sicker than others in the first place. And if you think about these 3 levels at which health disparities can arise, differences in quality, differences in access to care, differences in underlying exposures and opportunities, you could draw it as a pyramid, or even better yet, understand it as an iceberg, where the huge hidden base are the differences in the conditions of our lives. And then very often the same people who have been made sicker are frustrated because of limited access, at least in our system, to the healthcare system or to quality healthcare, or I don't know what your different situation is here. And then even the lucky ones, and I'm sure that must be true here too, even the lucky ones who get into the system sometimes experience differences in quality of care. But now remembering these three levels at which health disparities arise, we're going back to the cliff. But now, we're going to recognize we're really not dealing with a flat two-dimensional cliff, but actually we're dealing with a three-dimensional cliff. And at some parts of the cliff, there might be an ambulance here, but maybe that ambulance has a flat tire. So it slower goes off in the wrong direction. Or maybe there's no ambulance there at all, and maybe there's no net nor fence, and usually at those parts of the cliff, the population is being pushed closer to the edge. So now, let me label this three-dimensional cliff with how health disparities arise, where, that's where they just got pushed closer to the edge. Okay. Sorry, my timing's off. But now let's label these observations about the three-dimensional cliff with how health disparities arise. So differences in quality of care, that's represented when the ambulance is there, but it slower goes off in the wrong direction. Differences in access to care, no ambulance, no net, no fence. Differences in underlying exposures and opportunities are represented by that closer proximity, that greeny population to the edge. So now that we recognize that we're dealing with a three-dimensional cliff, there's a whole new set of questions that arise, right? First of all, let me say this. The first question is, how did the cliff become three-dimensional in the first place? And that's usually because of historical injustices that are perpetuated by present-day contemporary structural factors. But given that the cliff is three-dimensional, we need to ask, why are there differences in how resources are distributed along this cliff face, and why are there differences in who's found at different parts of the cliff? Why are the oranges back there in the way and the greenies being pushed closer to the edge? And when you start asking and addressing these kinds of questions, you're doing something that differs from addressing the social determinants of health, which I described as moving the population away from the edge of the cliff, addressing poverty, adverse neighborhood conditions, and the like. When you start trying to address the distribution of resources and populations along this three-dimensional cliff, you're now doing what I describe as addressing the social determinants of equity or inequity, including racism, sexism, heterosexism, economic systems like capitalism and the like, right? It's a different process. And so actually with this cliff, I've just so three different dimensions of health intervention. One dimension is a line, two dimensions is a flat plane, three dimensions is space. Along the line at the edge of the cliff is where we can display all of our curative and preventive health services. And even, in the US, we're trying to get to Canada or to the UK or something. We're trying to get beyond the Affordable Care Act, right? But in the US, even our Affordable Care Act, that's an edge of the cliff conversation. And even when we do achieve universal access to high quality health care, which is how a civilized society values all of its people equally, that's still going to be an edge of the cliff conversation, right? Okay? And as good as any system is, you can overwhelm any system if everybody's pushed against the edge of it. Which points out the need to move into that second dimension, which I can display in a flat plane. We have to be addressing the social determinants of health. We must be moving the population away from the edge of the cliff, addressing poverty, adverse neighborhood conditions and the like, if we want to have large and sustained improvements in health outcomes. But the trick here is if you are moving the population away from the edge of the cliff without recognizing that you're really dealing with a three-dimensional cliff, you're at risk of moving some of the population, but not all of the population, and actually making health disparities worse. So we need to acknowledge and address the three-dimensionality of the cliff and address these social determinants of equity or inequity, which include racism, sexism, heterosexism, ableism, capitalism, and the like, if we want to achieve social justice and eliminate health disparities. So I often stop here and invite people's questions, but we can't do that right now. So if you have a question, just ask me later. Just remember it. I will say that I'm very clear that we need some of all of these. We need an ambulance. We need nets, fences. We need some of all of this. And each of you in this room might have a day job that's at some different part of the cliff. And if I were talking to medical students, I know that people are being trained to be the best ambulance drivers they can be, right? And residencies. And it's important. We need people scooping the bodies up and speeding them on to care. But even if that's your day job as an ambulance driver, you need to wonder, is there a net above me? How strong is the net? Is there a fence? How strong is that fence? How close is the population to the edge, right? And at what part of the cliff am I operating? And do I operate differently when I'm at different parts of the cliff, right? So in our day job, we could be nets, fences, all of this. But all of us as citizens of whatever nations we're citizens of, we need to be concerned about the whole. And when you're concerned about the whole, that means that you have to first and foremost be concerned about that three-dimensionality of the cliff and the differential distribution of resources and populations. Okay. I did want to share with you some questions that have come up before about the cliff. The first, at least in the United States, and maybe I should have taken these slides out, but here we go. Why do we spend so much money on ambulances at the bottom of the cliff? My answer to that is twofold. First of all, in the U.S. context, lots of money being made down there, right? But also, we have a very narrow focus on the individual in my country. So narrowly focused that we don't even recognize there's been a health problem until somebody's fallen off the edge of the cliff. So we're busy trying to either catch them in nets or scoop them up off the bottom without wondering how close are the different populations to the edge. We don't even use aggregate measures of health. Here's a second question. Why are the greenies launching themselves over the edge of the cliff? So that you get that when they say, well, why are they eating so much fried chicken? Or why are they drinking so much soda? Or why aren't they reading to their kids? Or why are they doing this? This is all about behaviors, right? And so that also reflects the narrow focus on the individual, because when you're narrowly focused on the individual, it makes systems and structures that are moving the population closer to the edge either invisible or irrelevant, right? But it also reflects a second characteristic of my country, which is that we are ahistorical. We act as if the present were disconnected from the past and as if the current distribution of advantage and disadvantage were just a happenstance. So we look at this and we're like, oh, we don't even ask, how did the greenies get pushed there, right? And what are the efforts? And what happened to their ambulances, nuts, and fences? They may have built for everybody, and then theirs got taken away. I mean, there are lots of questions. We don't even understand the history. A third question that people don't usually ask out loud, but we often acted, at least in my country, in our actions. This situation looks fine to me. What's the problem with a three-dimensional cliff? And we act that when we might leave our lovely, comfortable neighborhoods, drive across a distressed neighborhood, maybe you drive across a reserve, that has fewer resources, and get to our lovely job somewhere and not feel a strong sense of urgency to do something about the situation in that community that we just drove through. And that reflects our endorsement, at least in my country, is a very strong national story of the myth of meritocracy. The story that goes something like this: if you work hard, you will make it. Now, I give you that most people who have made it have worked hard, right? But not everybody in my country who's made it has worked hard. Just look. Please just look. Okay. But so given that most people who've made it have worked hard, there are still many, many, many other people working just as hard or harder who will never make it because of an uneven playing field, right? Which is structured and maintained by racism, sexism, heterosexism, these systems of structured inequity. And when we are in denial about these systems of structured inequity, then we're endorsing the myth of meritocracy. More on that later. So now, I feel so antsy because usually I know what you guys are thinking because of the questions you asked, but we're just plowing straight through. So now I'm going to raise something. So now what have I done so far? I've given you a quick image to help you understand that racism structures two-sided or multi-sided signs. This is true of sexism and any of these other isms, right? Are structuring two-sided signs, and that very often people who are on the inside don't even recognize there's a two-sided sign going on because their experience of privilege is validated by what they see on the open side, and they don't even understand that there's another side, right? So I gave you that. I gave you a definition of racism as a system. And then I have said that we in the health side of things need to understand that addressing racism is a core part of our health endeavor. It's not just being an ambulance at the bottom of the cliff, that we need to address all of these levels, at least as citizens, if not in our daily work doing health. Now I'm going to shift gears and say, when you ask the question, how could racism turn into health outcomes? In my country, the question would be, how does racism turn into differences in asthma prevalence between populations, or differences in obesity prevalence, right? Or differences in cancer survival rates or cancer incidence rates and the like? I find it useful to think about three levels of racism: institutionalized, personally mediated, and internalized. So I'm going to briefly describe or define these levels, give you examples of how they manifest in the US, and then illustrate them with my Gardener's Tale allegory. You good? Okay, good. So that first level of racism, institutionalized racism, is the system, if you will. It's the constellation of structures, policies, practices, norms, and values that taken together result in differential access to the goods, services, and opportunities of society by race. When I say race, here you can plug in by ethnicity, you can plug in by immigration status, you can indigenous status, you can plug in whatever those things are that are operating most, racialized status in this society. But differential access to the goods, services, and opportunities of society by race. This is the kind of racism that does not require an identifiable perpetrator because it's been institutionalized in our laws, customs, background, norms. It shows up as inherited disadvantage and it's reciprocal inherited advantage. We see it in terms of material conditions and in terms of access to power. So differential access by race to quality housing, or excellent educational opportunities, equal employment opportunities, even the same level of income at the same level of employment. Clearly, those things impact health. Differential access to medical facilities, including linguistic access. Differential access to a clean environment. In my setting, we have a very well-documented disproportionate placement of toxic dump sites or bus transfer stations in communities of color. And in terms of power, differential access to power as health information or even information about our own histories. Differential access to power as resources, it could be material resources or even kind of social networking resources, knowing somebody on the board. And differential access to voice in media and government and the like. In the United States, where there's so much interest in social determinants of health, right? But often people who are interested in social determinants of health never say the word racism, right? I often about now get the wild hand waving, excuse me, Dr. Jones. But look at that top set of examples there, housing, education, employment, income. Isn't that what we call social class? Why do you have that on a slide about racism? Are you talking about racism or are you really, really talking about social class? That is a very important question that many in this room probably have right now in their hearts. So I want to answer it from my context, and I would say probably it transfers over to some of the Canadian context. So the start of my answer is that it doesn't just so happen that people of color in the United States are overrepresented in poverty, while white people in the United States are overrepresented in wealth. That is not just a happenstance. And for each marginalized, stigmatized, oppressed group of color, there's been some initial historical injustice, right? So I'm not going to go through the whole litany of U.S. because I'm not there, but I will just start by saying, for American Indians, that initial historical injustice was the taking of the land and the near genocide, and then moving the survivors to reserved lands, reservations, and then in some instances, something good was found under one reservation. Oops, you got to pick the people up and move them somewhere else. We have many, we had the same internment of Japanese Americans during World War II that you had without the internment of German Americans or Italian Americans. We have people who have lived in Mexico for centuries, never crossed the border crossed them, but now their children and grandchildren and great-grandchildren are being vilified and harassed, right? They find themselves now in New Mexico, now part of the U.S. For people of African descent in the U.S., the initial historical injustice was the kidnapping of West African people and our importation across the Atlantic with tremendous loss of life in the Middle Passage. And then for the survivors and their progeny for generations, what I describe as the coerced usury of our unpaid labor for centuries to build that country. But then in my country, if I start talking like that, people are like, oh, Dr. Jones, there you go talking about slavery. Dr. Jones, we all recognize that slavery was an unfortunate chapter in our nation's history. But Dr. Jones, don't you recognize that the enslaved people were emancipated by 1865, and we're now in 2019, so that makes that 154 years ago. All else being equal, Dr. Jones, don't you think the impacts of slavery would have washed out by now? But the key answer is in their question, all else being equal. All else has not been equal since 1865. All else still is not equal today, and there are present-day contemporary structural factors that are perpetuating each of the initial historical injustices that I didn't even give you the full litany of. And those present-day contemporary structural factors are part and parcel of institutionalized racism. So when people ask me, are you talking about racism, or are you really talking about social class? My answer is that institutionalized racism explains why we even see an association between social class and race, at least in my context, and I think that must be true here, especially when you're talking about your indigenous First Nations populations, right? It's not just a happenstance. Before I leave this, I have to say that you don't have to choose between being anti-poverty and anti-racist, right? In my setting in the US, people are like, oh, Camara, you just talk so much about racism. You don't care about poor white people, do you? And I was like, that is not the case at all. I care about poor white people, poor black people, poor Indian people, poor Hispanic Latino people, poor Asian people, poor every kind of people, right? But even if we developed a great anti-poverty strategy right now, it's going to be right here. Here's our great anti-poverty strategy. I would use it immediately, boom, to eliminate poverty. I go further. I would eliminate income inequality. If I use this tool without addressing the background structures, policies, practices, norms, and values, the background mechanisms of institutionalized racism, then even if I were to eliminate income inequality today, those mechanisms of institutionalized racism are deeply embedded, at least in my country, in the fabric of our nation, and were put in place to deliberately shunt different populations to different possibilities. Even if I flattened the whole thing out today, if I did that without addressing institutionalized racism, then in one generation, in 20 years, we would start to see a stratification by race again in terms of income. This is not an either-or proposition in any of our settings. We need both anti-poverty and anti-racism interventions. We do not have to choose. The last thing I want to say about institutionalized racism is that it can be through acts of doing, acts of commission, as well as acts of not doing, acts of omission, and very often institutionalized racism shows up as inaction, lack of action in the face of need. The second level of racism, personally mediated racism, I define as differential assumptions about the abilities, motives, and intents of others by race, and then differential actions based on those assumptions. So this is what most people think of when they hear the word racism. Somebody did something to somebody. It includes the different idea, the prejudice, and the different action, the discrimination. And I don't know if you guys are talking already up here about implicit bias or unconscious bias, so that's all wrapped up in here. How could that impact? Well, in my country, we have this horrible, continued from the time that police departments were the slave catchers, but the police killings of unarmed black and brown men and women without accountability. So that's one, because they think that that cell phone that that young man had in his backyard was a gun. Or they think that when you're walking down the street that you are threatening them, and they shoot you 16 times in the back like they did for Laquan McDonald in Chicago, and on and on. Physician disrespect. That can be as subtle as a physician not giving a patient the full range of treatment options because the physician figures that patient wouldn't understand, wouldn't comply, couldn't afford, or whatever they assume. It could be subtle like that, or it could be quite blatant, like sterilization abuse, which has had many iterations in the US history. Shopkeeper vigilance. I don't know if you know what I mean here, but being followed around in stores. Waiter indifference, not getting quick, respectful treatment. These are just two aspects of what some people describe as everyday racism, the microaggressions, the subtle communication of disrespect, which might be related to elevated blood pressures in communities of color that don't even go down at night, at least in the US. And teacher devaluation, a very important manifestation of personally mediated racism. Because if a teacher looks at a young child and thinks, that child can't learn, and puts them off in the attention deficit disorder track, right? That child won't even ever know their full potential, much less have the opportunity to develop to their full potential. Like institutionalized racism, personally mediated racism can be through acts of doing as well as acts of not doing. But even more important to understand is that it can be unintentional as well as intentional. You do not have to have intended to do something racist to have had a racist impact. The third level of racism, internalized racism, I'm defining here from the point of view of members of stigmatized races as acceptance by members of stigmatized races of negative messages about our own abilities and intrinsic worth. And actually, I also acknowledge, I have friends who do anti-racism training in the States who said, Camara, what about the internalized sense of entitlement that many white people have? Isn't that also internalized racism? I agree that it is, but I don't even have it on this slide yet because for the longest, I did not understand how an internalized sense of entitlement could turn into bad health outcomes. Although in the US now we're describing these diseases of despair, in white populations, suicides, and the opioid epidemic, which I interpret now as a sense of entitlement thwarted. But anyway, the rest of the slide is still from the point of view of members of stigmatized races. Examples include self-evaluation, feeling maybe I'm really not as good as. Maybe I shouldn't try to graduate from high school or apply to that college or try to get that job or live in that neighborhood. The white man's ice is colder syndrome. Has anybody in this room ever heard that phrase? It's phraseology from my parents' generation in the US. What it meant for people of color then, which it still means for many of us today, is say that I'm black and I need a lawyer. I might actually seek out a white lawyer over a black lawyer. Or if I'm black and I'm in the hospital, I might prefer the white doctor over the black doctor. In fact, if my lemonade were warm, I might go way down the street to get the white man's ice over the black man's ice, deeply believing that the white man's ice is colder, deeply internalizing the myth of white superiority. Internalized racism shows up as resignation, helplessness, hopelessness, which turns into a lot of self-destructive health behaviors. And really, in its core, it's about members of stigmatized races accepting the negative messages about our own full humanity, the limitations to our own full humanity of the box into which we've been placed. So that when we hear young high school students of color in the US, and one of them's trying to be the valedictorian, the number one in the class, and the friends are teasing her or him by saying, oh, so-and-so is just trying to be white, we need to challenge that. I don't know if you have that kind of thing here, but we need to challenge that, because since when did white people claim exclusive access to excellence? They did not. So now I'm going to, are you guys okay? I mean, I'm being very straight, and usually I have interaction, so I don't know if you guys are like, oh, okay. But now I'm going to lighten it up again with another story, okay? Okay, thank you. Actually, I need some water, so I'm going to just take a little bit of water. Oh, thank you. Okay, thank you. So I got it. Okay, thank you. Okay. So now, this is another story to help us understand these three levels of racism and how we're supposed to proceed and how they're related to one another and all. So this story was also sparked by something that happened in my own real life. So my husband and I have been married about a year. We were moving down from New York to Baltimore so I could finish my PhD at Hopkins. We bought our first freestanding house, cute little house with a big wraparound porch with flower boxes dotted all on the porch, right? And we were excited, but we bought the house in October. That's not the time to plant, not even in Baltimore, Maryland, right? It's too cold. But when spring came, my husband, who loves to garden, ran out with our marigold seeds, going to decorate our cute little house. But he came right back in because he said, Camara, some of these boxes have dirt in them, but some of these boxes are empty. I'm going to ask the tech person, if I come out, can you see me all right still? Oh, no, but you can't hear me. Well, I'm going to stay right here. Are you guys okay? Can you sort of see me? Because I'm going to use my hands a lot. So anyway, so he said some of the boxes have dirt, some of the boxes are empty. I need to go to the gardening store, right, to get some soil. So he goes to the gardening store, and he hauls back big old bags of potting soil, and then we fill up the empty boxes. Then we take equal numbers of our marigold seeds, and we put them in the boxes, and we water all the boxes. And because I'm not the gardener in the family, by this time I'm exhausted, right? So I just sit back. I'm going to be delighted. Well, about 3 weeks later, I'm walking out of my front door, and finally I pay attention to these boxes on my porch, and what I saw made me literally stop in my tracks. Because it made me think that we had planted completely different species in some boxes versus others, because some of the boxes were full of plants, and the plants were tall and vigorous. And some of the boxes just had a few plants in them, and they were scrawny and scraggly looking. And then I realized what had happened. That potting soil that my husband had bought turned out to be rich, fertile soil, so that every single seed planted in the rich, fertile soil has sprouted. The strong seed had grown very tall and vigorous, but even the weak seed had made it halfway up. But that old soil that we had found there turned out to be poor, rocky soil. So the weak seed planted in the poor rocky soil just died, and even the strong seed in the poor rocky soil had to struggle to make it to a middling height. And a few of you guys are nodding, so maybe there's some gardeners in this room, right? And maybe you've composted half of your garden, and maybe you've seen this image with your own real eyes, and the image is about the importance of the soil, the importance of the environment. But now I'm going to take this image And I'm going to make this a story about racism by introducing a gardener. So now I'm going to have a gardener who has 2 flower boxes, one which she knows to have rich, fertile soil, one which she knows to have poor, rocky soil, and she has seed for the same kind of flowers, except some of the seed is going to produce pink blossoms, and some of the seed is going to produce red blossoms. And the gardener prefers red over pink. So what does she do? She takes the red seed, she puts it in the rich, fertile soil, pink seed in the poor, rocky soil. 3 weeks later, in her flower boxes, she sees what I saw in mine, that rich, fertile soil, all the red seed sprouts, strong red seed, tall and vigorous, weak red seed makes it halfway up. In the poor, rocky soil, the weak pink seed dies. Here comes the strong pink seed, struggling to make it to a middling height. And then in those 2 flower boxes, those flowers go to seed. And the next year, the same thing happens. And then those flowers go to seed. And year after year after year after year, same thing happens. Till finally, about 10 years later, the gardener's looking at her flower boxes, and she says, you know, I was right to prefer red over pink. So we're going to interrupt the story there to say the first part of this story is how institutionalized racism works, where you had the initial historical injustice of the separation of the seed into the 2 types of soil. You had the contemporary structural factors of the flower boxes keeping the soil separate, and then through inaction in the face of need, perpetuation of this inequity. But let's pick the story back up to say, well, where is personally mediated racism in the garden? Well, the gardener's looking at her flowers, and she looks at the red flowers. She says, oh, those red flowers are just beautiful. Then she looks at the pink flowers, and she says, oh, those pink flowers sure are scrawny and scraggly. So she plucks off the pink blossoms before they can even go to seed. Or maybe she notices that a pink seed has blown into the rich, fertile soil, so she plucks it out before it can establish itself, which is some of the anti-affirmative action stuff that goes on. And where would internalized racism be in the garden? Well, the red flowers are just living their lives, enjoying being red, many of them not acknowledging or maybe even not understanding that they're benefiting from enriched soil. Pink flowers are looking over at red, thinking red is mighty fine, and wishing with all their hearts that they too could be red. And here come the bees, minding their own business, collecting nectar, but of course pollinating at the same time. So here comes a bee into one of the pink flowers, and then to another pink flower, and to this pink flower, and this flower's like, get away from me, bee. Do not bring me any of that pink pollen. I prefer the red, because the pink flower has internalized that red is better than pink. So now the question arises, what do we do to set things right in this garden? Well, first we could address the internalized racism, right? We could go over to the pink flowers and we could say, pink is beautiful, power to the pink. And that is an important intervention. I'm not making light of that. But if that's all we do, it is not going to change the situation in which those pink flowers find themselves. So you might say, okay, let's address the personally mediated racism. Let's have a conversation with the gardener, or better yet, in the US, we would say, let's have a workplace multicultural workshop for the gardener. It's all good, right? So we have our little workshop. In the workshop, we say, dear gardener, would you please stop plucking those pink flowers? And maybe she will, maybe she won't. But even if she does, it's still not going to change the situation which the pink flowers find themselves. If we really want to set things right in this garden, we must address the institutionalized racism, which means we have to either break down the boxes and mix up the soil, or if you want to keep separate boxes, that's all right too, although it makes it easier if it's going to be that same gardener for her to continue segregating resources going forward. But if you keep separate boxes, what does it mean? It means that you need to enrich that poor rocky soil until it is as rich as a rich fertile soil. And when you do that, the pink flowers will flourish. They'll be looking beautiful, grand, and glorious. And you know, those pink seed have been selected for survival and strength. So they might even look a teeny tiny better than the red, but I don't always say that because in the US, that's some people's great fear, right? So I don't know if it's all right to say that here in Canada or not, I don't know. Okay, but anyway, so let's say, so the flowers are equally beautiful. Now that you've enriched the poor Rockies, the flowers are equally beautiful, so that you'll also have addressed the internalized racism, because pink won't be looking over at red, thinking red is better or wanting to be red. And in that intervention on the institutionalized racism, you may also address the personally mediated racism. Now, the original gardener may have to go to her grave preferring red over pink, but her children who grow up and see the flowers equally beautiful will be less likely to have that kind of attitude. So this story has been to illustrate those 3 levels of racism and to strongly suggest that if we want to set things right in the garden, we need to at least address the institutionalized racism. Good to address all the levels at the same time, but at least the institutionalized, and when you do, the other levels may take care of themselves. But here's one more question that we haven't raised yet, which is, who is the gardener? After all, the gardener is the one that I gave the power to decide, the power to act, control of resources, which are actually the elements of self-determination. So who is the gardener? Well, government is always a huge part of the gardener, but not the only part of the gardener. Media, corporations, foundations, communities, to the extent they have self-determination. But whoever the gardener is, it is dangerous when the gardener is allied with one group. I painted her red. That's why she prefers red over pink. And it's also dangerous when she's not concerned with equity, when she can look at her flower boxes and think that her garden is beautiful, thank you, because she's not even counting the pink flowers as part of her garden. So our challenge is, what do we do about the gardener? To make the gardener striped or polka dotted or fuchsia? Do the pink flowers have to grow and recruit their own gardener? Lots of questions can come out of this. I'm just going to share with you very quickly 2 questions that have come up, and then I'm going to speed through the last few slides, okay? But once I was asked, after doing my story, again, one of these hand waving, excuse me, Dr. Jones, but why should the red flowers share their soil? When I heard that question, I loved that question because it showed me the power of this story to start conversations about racism that would otherwise be difficult if we're talking about racism between you and me. My answer to that question, why should the red flowers share their soil, is that actually that soil doesn't belong to the red flowers, it belongs to the whole garden. But here's another question. What if that's not the original gardener that we're looking at? What if we are now looking at the gardener's great-great-great-great-grandchild? Here we are. And that great-great-great-great-grandchild has always seen the flowers looking like that, may not even think there's a problem to be solved. So here's a very quick 3-part answer to that. First, we have to make the differences in the height and vigor of the pink and red flowers a problem requiring urgent solution. And then in order to solve it, the second thing is we must make those flower boxes transparent. We have to be talking about the differences in the quality of the soil. And then third, as we make the flower boxes transparent, we need to be sure that everybody knows that the pink seed did not just go launch themselves into that poor rocky soil. So we have to talk about history, and we have to talk about the gardener's role in setting up the whole situation, how the gardener's initial preference for red over pink, which some people will call cultural racism. In the US context, it is flagrantly white supremacist ideology right now, how that set up the whole situation, right? Because if we do not deal with that values piece, the history piece and the values piece, understanding the gardener's agency and setting this whole thing up, even if we were to compel that red gardener to enrich the poor rocky soil today until it's as rich as the rich fertile soil, if she continues to prefer red over pink, she will continue to privilege red over pink going forward. So when I defined racism as a system of structuring opportunity and assigning value, I used to be all about the structure, opportunity structure piece, until I understood that the values piece is just as important for us to address. So now I have just 3 more ideas to share with you, but very quickly. First of all, it's good for us to name racism, but that's insufficient. So it's necessary. We need to say the word racism, because if you don't say the word racism, you could talk about a lot of things. You could talk about race, ethnicity, disproportionalities, disparities, equity, inequity. We could talk about implicit bias. All of those things are excellent things to talk about. But if you never say the word racism and get the ism out, the system part of it, then at least in the US context, you're totally complicit with the widespread denial. If you don't say the word racism in the context of widespread denial of racism, then you're complicit with that denial, right? So, but then, what do you do about it? Well, you have to identify levers for action. So we have to ask, how is racism operating here? And racism operates, it's not a cloud or miasma that we can't get a handle on. It's a system with identifiable mechanisms in our structures, policies, practices, norms, and values, which are different elements of decision-making. So structures are the who, what, when, and where of decision-making, especially who's at the table and who's not, what's on the agenda and what's not. Policies are the written how of decision-making, practices and norms are the unwritten how of decision-making, and values are the why. And we need to ask, often I give examples, but we don't have time, but you need to say, how is racism operating here in Canada, in Toronto, or in Hamilton or Ontario? How is it operating in my child's school? How is it operating on that reserve or in relationship of the reserve to others? You can identify real levers for action by looking around and saying, who is not at this decision-making table who has an interest in this proceeding, right? And then your job when you see who's not there is not just to represent their interests, but find them a way to the table. Going through all of this, it's an excellent exercise. The definition I gave you of racism can be generalized, as I alluded to before, to be a definition of any system of structured inequity. What's sexism? That's a system of structuring opportunity and assigning value based on gender that unfairly disadvantages, unfairly advantages, and saps the strength of the whole society. There are many axes of inequity that are operating in our societies today, intersecting in communities and in individuals. And all of these operate at least as risk markers for how opportunity is structured and values assigned, even as a smaller subset are actually risk factors in the progression to disease. Here's a three-part definition of health equity, which I won't linger over, but just to say that health equity, if we're talking about health equity, it's a process. It's not an outcome. It's assurance of the conditions for optimal health for all people. In the U.S., our Healthy People 2020 definition starts out that health equity is attainment of the highest level of health for all people. I agree that that's our goal. But what did we hit that last Sunday? Are we done? No, I don't think health equity is an outcome. It's a process. How do we get there? Achieving health equity requires at least these three things: valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources not equally, but according to need. How is health equity related to health disparities? Health disparities will be eliminated when health equity is achieved. Health disparities is counting the different numbers of different colored bodies at the bottom of the cliff, or counting the differences in the height and vigor of the pink and red flowers. Health equity is all that opportunity structure stuff that came before. There are three huge barriers to achieving health equity that I named before. Our narrow focus, at least in the U.S. context, and I don't know, you guys might have different barriers or some of the same and more, I don't know. But in the U.S. context, our narrow focus on the individual makes systems and structures invisible or irrelevant. And it also makes us not understand but for the grace of God go I, we're all in this together, right? And it makes our sense of self-interest very narrow. The fact that we're ahistorical and act as if the present were disconnected from the past and the current distribution of advantage and disadvantage were just a happenstance hampers us. And also when you're ahistorical, first of all, you don't know how things came to be. You figure I was born, these things were this way, must have always been this way, must always going to be this way, right? So you don't think that systems can be changed. But also if you're ahistorical, you don't even understand the history of change. Like if we want to be about change, how have other societies risen up and changed important things? And then this myth of meritocracy, the fiction that if you work hard, you will make it. Right? And the fact that when you deny racism, you're supporting this myth of meritocracy. You're blaming people if they didn't make it, not on racism or other systems of structured inequity, but you say those people must be lazy or stupid. Right? There are at least two ways you can deny racism. You can say, I don't think racism exists, or at least not anymore, or you could never say the word. Because as I said before, if you never say the word racism in the context of widespread denial, you're complicit with that denial. So here's what we can do. Going back to the restaurant, I opened with this restaurant. Here are like 5 kinds of strategies, like types of strategies that we can take. And then I'm going to end with one other quick story. The first kind of strategy is that we need to actively look for two-sided signs, for evidence of two-sided signs. We need to shine the bright light of inquiry. Is there something differential going here in terms of opportunities or outcomes by social class, by geography, by racialized status, by ethnicity, by immigration status, by indigenous status? Is there, by gender, is there something differential going on here, right? Then we need to burst through our bubbles to experience our common humanity. Each of us is in a bubble of experience of our jobs, and if we have children, our children's schools, and our communities, maybe we participate in some religious thing. Some of our bubbles are quite big with very thin soap bubble boundaries, but it's still a boundary, right? Some of our bubbles are very small with thick plexiglass boundaries, and in the US, those are getting tinted and polarized, like people don't ever want to see out, right? Whatever your bubble's like, we need to create as institutions and opportunities as individuals, opportunities to burst through our bubbles to understand that just across town, there are people who are just as kind, funny, generous, hardworking, smart as we are, who are living in very different circumstances. We need to experience our common humanity in different circumstances to understand that there but for the grace of God go I, and that it's not because these people are lazy or stupid that they find themselves where they are, and understand our agency in being able to do something. We need to be interested in the stories of others, believe the stories of others, and join in the stories of others. And part of that, being interested in the stories of others, is being interested in our own history and other people's histories. We need to see the absence of. Whenever you find yourself at a decision-making table or set a decision-making table, you need to look around and say, who is not here, who has an interest in this proceeding? And as I said, don't just represent their interest, find them a way to the table. What is not on the agenda? What policies are not in place that if put in place could make this a much better situation? And finally, we need to reveal inaction in the face of need. Because inaction in the face of need is how institutionalized racism operates now these days, right? We have to abandon this, what's the problem with a three-dimensional cliff mentality. That is inaction in the face of need. So now, I'm going to end with a story, and I have my little thing because I'm going to now walk. So I'm going to test, is this working? Is the mic working? Yes, good. Okay, this story, Life on a Conveyor Belt, Moving to Action, is actually not based on something I saw, with my own real eyes. It's based on an image in the book, Why Are All the Black Kids Sitting Together in the Cafeteria? And Other Conversations About Race by Dr. Beverly Daniel Tatum, where she describes that for most white people in the United States, nobody's trying to be racist, right? In fact, people, they just, you call somebody racist, that's an insult, like the highest insult, right? But most people are just living their ordinary lives, going to work, sending the kids to school, but they're on a conveyor belt that's moving inexorably through racism and toward racism. I want to expand on her image of racism as life on a conveyor belt, a passive process, to talk about how we can become actively anti-racist. So I am going to put us on this conveyor belt where for the people who are on top of the conveyor belt, they're not trying to be racist. Actually, the conveyor belt is also running over the bodies of other people. So not all of us are on top of this conveyor belt, right? But so you're just going to work, going to school, but you're moving inexorably through racism. And actually, there's a big sign up there that says racism, racism, racism. But most of us are so involved in our lives, we don't even look up. Or we might look up and we go, oh, racism, and then we close our eyes. So we're in denial, right? Or we might go, racism, and we turn around, but we don't do anything else. So maybe we're colorblind, right? And we're still on this conveyor belt. So what do I suggest that we do now that we understand that we're on this conveyor belt? Well, here we are, going to work, going to school. We look up, we see racism. Yes, you've got to turn around. But you also need to take a step, right? And another step, you have to become actively anti-racist, and you need to start walking at least as fast as the conveyor belt is moving just to stay in the same place. So let me ask you this. What happens when you're walking backwards on a crowded conveyor belt? You start bumping into people, and it becomes uncomfortable for them and uncomfortable for you, and they're like, hey, buddy, watch out, where are you going? Which is your opportunity to do the first of 3 stages of being actively anti-racist, which is to name racism. You say, do you see where we're going? Do you want to go there, or will you turn around with me? Now, most people do not want to be disturbed out of their comfort. So they'll be like, hey, buddy, just watch out. But maybe 1 or 2 will turn with you. So now you have 2 or 3 of you walking backwards on this crowded conveyor belt. You keep bumping into people, and you keep naming racism, and you keep inviting more and more people to turn with you to become actively anti-racist, and more will turn. It'll never be 50%. Don't hold out for 50%. But anyway, as you get more and more, now you develop like a critical mass, so you don't even have to just stay in the same place. You can actually start moving, not just away from the sign, but where you're going. You're trying to get to the motor that is running this conveyor belt. So now here we are at the motor. So now this is the time for the second stage of being actively anti-racist, which is to ask the question, how is racism operating here? Looking at the elements of decision-making, the structures, policies, practices, norms, and values. So I think it's this lever. I'm grab the lever, and the whole system starts shaking, and I've done it. Except racism is a very fancy system. It reconfigures itself, and it keeps on going, which talks about the importance of the third stage of being actively anti-racist, which is to organize and strategize to act. So as I'm pulling up on this lever, I need you to push a button. I need you to swing that lever. I need you to pull on the pulley. I need you to grab this. I need each and every one of us to take some part of the system, because I do believe that all of us working together can dismantle this system and put in its place a system in which all people can know and develop to their full potentials. It's a great world that we could build. The urgency in my country is extreme right now, and I hope that you guys will all help. Thank you very much. Thank you. Thank you. Thank you. Thank you.
Thank you so much, Dr. Jones. I wonder, I know we're running a little late, but we'll have time for one or two questions, if that's okay.
That's great with me. Thank you for that.
So one or two burning questions. I'm sure a lot of you would like to chat with Dr. Jones, but are there any burning questions or comments?
Yes.
Do you think it's possible to have the end of institutionalized racism without fixing income inequality?
The question is, do I think it's possible to have the end of institutionalized racism without fixing income inequality? No. Capitalism and racism are handmaidens to each other. They work together, and so no. I don't have to go on.
Last question at the back.
Yes.
Can you go further into diseases of despair and thwarted entitlement?
Okay, so the question is, could I go a little, elaborate a little bit on the diseases of despair and thwarted entitlement? So I haven't thought as deeply as I should, or else it would be already on my slide. But I think that the evidence of this sense of entitlement, I'm going to go to the flower boxes first, and then I'm going to go to Trump voters, okay? So, no. So the question might be, what about the red flowers who find themselves in the poor rocky soil? Okay, so what do the red flowers, so it's not red soil and pink soil, I'm already clear about that, right? So the rich fertile soil is not the red soil, and the poor rocky soil is not the pink soil. But what about the red flowers who find themselves in the poor rocky soil? What do they do? So far what I've seen is they think that the red gardener is going to help them and pull them and put them back in the rich fertile soil, but that doesn't seem to be happening yet. But they have this notion of an alliance to power, but they're blaming the pink flowers for the rockiness of the soil, right? As opposed to understanding the inattention. And so they don't even find right now common cause with the pink flowers who are also in the poor rocky soil. There's almost a sense of, I am entitled to the rich fertile soil, and I'm just here temporarily, but this is your soil, right? So that kind of thinking. So what do I think? I think that a sense of entitlement, that sense of I could be a rich millionaire too, even though the rich millionaire has a real history of not paying workers who work on various properties and that kind of thing, right? Without understanding it, that sense of I'm red and therefore I'm entitled to this thing, and then seeing it not happen, right? Feeling that there's some betrayal in that entitlement, right? Not understanding that lots of other people have also been betrayed in that promise, but feeling entitled to the promise is just too destructive. Okay, thank you very much.
I'd just like to introduce Dr. Sonia Chanchlani to give closing remarks.
Good evening. I'm delighted to speak on behalf of the Chanchlani family at this annual celebration of global health. Our family takes great pride in our relationship with McMaster, a university and medical school that is renowned around the world for innovation, education, research, and healthcare. My late father, Vasu Chanchlani, was steadfast in his belief that research was fundamental to our understanding of chronic disease and preventative health. He and my mother sought to look to the future and therefore collaborated with the center to provide innovative training to the next generation of healthcare researchers. My father would be delighted to be here today to see how the Chanchlani Global Research Health Award and lectureship has attracted an outstanding caliber of international candidates, scientists, and physicians to speak here at McMaster, especially with this year's Chanchlani Health Award going to Dr. Camara Phyllis Jones. Your work truly is at the forefront of health and disease prevention and embodies everything the award stands for. This year's award is particularly special to me as it's the first one that I'm able to attend in the past 7 years, but it's also the first award going to a female recipient. As a physician myself, working in the past decade in urban and rural settings in Ireland and Australia, it wasn't until I pursued my own Masters of Public Health with its stark patterns of data that I was really able to fully comprehend the significant impact of the social determinants of health and how they impact our patient populations. I'm thrilled to present this year's Chanchlani Global Health Research Award to Dr. Jones, who has shown a much-needed light on the importance of reducing the gaps in health equity and equality for all. Thank you.
Thank you very much. And I have no more words except thank you very much.